17 factors affect your risk for dementia, as a study suggests. So this was a CNN story from a few weeks ago, Friday, April 4th. I like this story, and I'm going to tell you why. Because when you look at these 17 factors, most of them are lifestyle related. And in my experience, there is a disconnect between the perception around what causes dementia. We had Dr. Napoli in a few episodes ago to talk about dementia and the treatment of dementia, which is revolutionized and will continue to revolutionize. Most people think of dementia as a genetic disease, something that just happens to you because of your genes. That's not what the science tells us. The science is telling us that dementia is very much a lifestyle-related disease for the vast, vast majority of people who get it. And what this study showed, you look at these 17 factors, let me read some of them to you. You tell me if they sound familiar. Blood pressure, body mass index, kidney disease, blood sugar, total cholesterol, alcohol use, diet, hearing loss, pain, physical activity, sense of purpose in life, sleep quality, smoking, social engagement, stress, cognitive activity, and depression.
Low social engagement, right? So going along with lack of purpose. So it seems like some of them are generally just good health habits for long life. Some of them are common sense.
That's
but
right.
Then I wouldn't necessarily have thought of the mental health ones, which that's interesting as well.
I mean, this is the thing about this study is it's not the only study that's shown a strong association between dementia and sort of social engagement and sort of these mental health type things. This is showing up in other places. So it is important. That's why, in Dedham, we just built a senior center, right? And most towns have it. That's important for people, that older adults staying engaged and having socialization and getting out into the world is really important.
Yeah, and let's face it, people who are retired and in a weakened state. I mean, both my parents are in their 80s, and my dad especially certainly doesn't get around like he used to. Left to his own devices, he might just sit and watch baseball games all day instead of, so it's all, needless to say, I'm not the expert. Dementia is all about the mind. So you can see how not keeping that muscle exercised would
stimulate it. Yeah.
Right. And it's not just watching TV. It's talking to people.
Right.
It's maybe even like sort of problem solving. Or I wonder do you recommend any kind of, I hesitate to even suggest it, but like an app, there are apps that are supposed to keep your brain fresh.
None of those have been clinically proven.
Okay.
But as a general rule, I do think things that are like brain games or puzzles, playing an instrument, reading, Sudoku, crossword, whatever. I do recommend all that. I think all of it's good.
Yeah.
And I think you look at studies like this, they don't specifically say, this app or this thing, but in general, that stuff appears to be protective against dementia.
Yeah.
And I think Sal Napoli, when he was here, we asked him that, and I think he said that at some point too.
I got to imagine it's part of the puzzle for sure.
The other thing about some of these 17 things that protect dementia, look how many of them are related to like obesity and lifestyle and healthy diet, your blood pressure, your body weight. That is a huge piece of it too. And the whole insulin resistance and inflammation and that whole thing we don't really understand, but that is a big piece of the dementia, just like it is for a lot of the other illnesses we deal with.